Okay, ladies and gentlemen, sorry for the delay, but we're waiting for our guests. Excellencies, guests, dear participants, our virtual colleagues. Mental Health Project. I would like to welcome you for the launching ceremony of our project, Kurdistan Mental Health Project, which is implemented in cooperation with the Oxford Cognitive Behaviour Centre, KR-UK-IMPAKT, as well as KR-UK-IMPAKT organization, and also funded by the Oslo Foundation. The aim of the project is to address psychological issues and damages that have arisen in the last few years. Through providing training, particularly in cognitive behavioral therapy. Of course, our colleagues from Oxford, Peter will talk about this in details. I would like to take this opportunity to thank everybody who contributed to the successful implementation of this project. Many thanks to Mr. Jonathan Randal, Mr. Hugh Paul, Chris Bowers, Isabella, Dr. Zakia, who is honoring with her presence, Dr. Arif, who is unfortunately not with us today, Dr. Rawsht and Mr. Diler, Dr. Chinar and Dr. Ava also from the UK. And all the people who are joining us from Oxford, so too many of them, I'm going to name them each, but thank you each and every one of you. Now it's your turn to make your remarks.
The floor is yours.
Okay, so I'm just going to show a couple of slides. Oh, I'm sorry. Could I be given screen sharing, please? Who is the host? If I made the co-host, please. Someone needs to allow me to share my screen.
Okay.
Thanks. The simplest way would be to make me co-host. Thank you. I think that's yes. Okay. Okay. So right. Okay, so I'm going to very briefly introduce the Oxford end of this. Can you hear me? Okay. Can you see the slide? Yeah. Okay, thank you. Before we start, I actually want to acknowledge someone who sadly is not here. And from the Oxford end of things, this project was led initially by Martina Muller, who sadly died last year. And I just want to remember her contribution. She was a great friend. And I think the fact that this has progressed so well is a testament to her amazing work. The I'm Paul Sakolksvis. I have overall charge of the Oxford Centre for Psychological Health, which includes the OCTC. Let me just say something about history first, which is that the university that I sit in was founded in 1096. So it's not quite 1,000 years, but it was quite a long time ago, which kind of would make it a fossil to a degree. The program here is being delivered by the Oxford Cognitive Therapy Centre, which is significantly newer. I think it's about 40 years old now, and it's also linked to the Oxford Institute for Clinical Psychology Training and Research, which is about 50 years old. I'm just giving that as context. The person who's kind of really important is Alison Croft, and I'm going to hand over to Alison in a moment. Alison is the joint head of the Oxford Cognitive Therapy Centre and has been leading at the senior level for this project, ably assisted by Amandeep and Kevin, who you'll be hearing from later. So I'm delighted that we're able to collaborate on this enterprise. It's very exciting, and I think it's very important both for ourselves and I hope for people in Kurdistan. So I'll hand over now to you, Alison.
Thank you, Paul. So, as Paul said, I'm Alison Croft, clinical psychologist and joint head of the Oxford Cognitive Therapy Centre, and I'm really delighted to be here today to see this course launch. I've been involved in its development with Martina Muller from the very first contact from Chris Bowers and his colleagues back in 2021. So it's been a long journey, but it's very satisfying to see this course finally become a reality today. So I think Chris is going to speak a little bit about the genesis of the project later. So let me tell you a bit about the course and the training providers, the Oxford Cognitive Therapy Centre. So this training programme aims to establish a self-sufficient CBT, cognitive behavioural therapy workforce in Kurdistan. It will achieve this by equipping practitioners with the CBT skills necessary to implement evidence-based psychological therapy for the most common psychological disorders within the context of your culture. To ensure the new workforce can be sustained into the future, we aim to go on to train a group of graduates of the course as CBT supervisors and potentially as trainers, eventually eliminating the need for external input. Currently, the course is funded for 2 years, and in year 1, we'll train 30 students from across the Kurdistan region of Iraq who are working in government agencies, NGOs, and private practice. Therapist training comprises 24 days of training workshops delivered in teaching blocks remotely over Zoom. And therapists will carry out CBT practice alongside the teaching programme and will receive clinical practice supervision with members of our team every 2 weeks in small groups to support their developing CBT practice. Therapists will have their clinical work assessed to ensure it meets good clinical standards. This will be led by my colleagues, Dr. Kevin Mears and Amandeep Sumal, who are both here today, as well as other members of our team. In year 2, graduates will be offered ongoing small group clinical supervision from our team to develop their clinical skills further and support their ongoing clinical practice. During this year, we aim to select and train a group of suitable graduates to train as CBT supervisors. We're also keen to research the impact of the training, and some planning is already underway regarding this. Depending on the availability of funding, we would hope to take a second cohort of students in year 3 and for the whole programme to run annually thereafter, with scope to also train trainers within this timescale. OCTC input will gradually reduce as Kurdish practitioners, supervisors and trainers are skilled up and take over these roles. We would hope that by the end of year 5, a self-sustaining Kurdish CBT workforce could be in place. So why is a UK agency involved in this training programme? Well, sadly, the training and expertise is not yet available in Kurdistan. And as Paul has said a bit about the Oxford Cognitive Therapy Centre, we are nested within the United Kingdom National Health Service, the provider of government-funded mental health services for the UK, and we also work in partnership with the University of Oxford. In the UK and also internationally, we have a reputation as one of the best CBT training agencies. And if I may say so, this is perhaps why we were approached by Chris and his colleagues regarding this project. Our team is made up of a group of highly experienced and respected CBT clinicians, trainers, and supervisors who are recognised experts in their field. Members of our team have written widely respected books, teaching CBT practice, and have published research papers on CBT training and a range of clinical applications of CBT. So, since OCTC was founded, we've been delivering training to literally thousands of mental health professionals around the UK and in other countries around the world, including in Europe, the Middle East, and the Far East. Unlike many UK training institutions, we've always sought to support the development of CBT practice in countries where this was not yet available. This means we have experience of working in partnership with local agencies, such as ETTC, and of adapting our tried and tested training methods to meet local needs. Our team has always included highly expert clinicians in CBT for traumatised populations, which is particularly relevant for supporting the clinical work of practitioners in Kurdistan. Our vision has always been to provide the highest quality CBT training to those working at the front line of clinical practice, ultimately to improve the quality of care for the patients these therapists work with. We are really excited to partner with ETTC and with KR-UK-IMPAKT to deliver this course. And I'd like to take this opportunity to wish the students and the trainers every possible success with this amazing project. Thank you.
Barezan Oxford, Barezan Baru bin Seruta Idon Hazakami wana Barezan Nasu, ya Barez Khatu Zakia Jili, Waziri Talbani Malaysia Iraqi Kurdistan.
Okay, ladies and gentlemen, before we get to the project or the training, we have our honored guest, Ms. Zakia Salih, who is the Deputy Minister of Ministry of Labour and Social Affairs. And we also have Dr. Ali Rashid, head of the Erbil Municipality Council. Mr. Sabri, also a member of the Erbil Municipality Council. And Dr. Kanar, Director General from the Ministry of Planning. In the last few years, we have been working together in cooperation to implement a number of projects with these people and with the esteemed institutions. Now, we'd like Ms. Zakia to make her remarks.
Sakolksvis bakherat ki biarmi Ali Rashid dan kami harus lain ada sampai kanal Zakia Saeed Salih barezu barezu nekada online dan bakherat ki biarmi anda kan yuadar nekada tuani
Good afternoon, ladies and gentlemen. First, I would like to welcome our honorable guest, Dr. Ali Rashid, Dr. Kanar, and all the other participants. Thank you very much for allowing us this opportunity to join in this launch of the project.
So, spasi ETTC dekam كهمو بوارد دا هاوكار مامونا تايستا وكو وزارة كاروباري كمامات.
I would like to take this opportunity to thank the ETTC for being cooperative and very supportive of our Ministry of Labour and Social Affairs at every opportunity.
أروها سباسي سنتري علاجي نفسي لجامعة أكسفورد بريطانيا دكا.
And I would like to also thank the Oxford Cognitive Behaviour Centre.
هوي بيويستا كماجي إما صار لقال سنتر دانشتو ديال وزارة كاروباري كماماتي.
I would like to mention here that we started our meetings with the center, with the OCTC last year.
ليش أو دانشتني زور معناها بويا لقاليان.
Prior to the last year's meeting, we also met before that.
وهو بتواني دخولي كيوا كينيا ولا هريمي كردستان.
To discuss the possibility of providing such a training in Kurdistan region.
خوشحالم أمرو برهمي دانشتنا ندبينينو شو تبواري جيبجي كردن.
I'm very happy to see the fruit of those meetings and that the training is starting to be implemented today.
أنا خوشحالم كلهردو رجزا بنتلا لفولانا.
And I'm also happy to see that people from both genders are participating here in the training.
فهزارك وقدر ولاتي ما بتعبت هنيمي كردستان كارثات وجينوسايد وهالوها كارثة جيرجيا وزكاندا بالغاسوا.
Of course, you all know that Kurdistan region have been through lots of historical events and tragedies and have been through a lot of tragedies.
ومانغاي كردستان بلشتي أجابي سيري بكين لروي درونيا وأمانة هم كاريجري لسنا هو هم كارثاتنا.
And we know that all of these events and tragedies have a lasting impact on every individual and within the Kurdistani society.
ممكن عندك جال إما وقت سيري بكين كبو تشتيكي عاداتي بو ومانغاي كردستان.
Sometimes we look at these things as a normal part of life of Kurdistani people. But when we look at it more carefully, we'll see that the new generation might not have experienced these traumas and tragedies firsthand.
ويا بداخلك علين بينش أو لهوليش ليك ربدا ممكن أو جينا طازات وش شوك.
That's why probably that new generation was shocked last night after the tragic attack on Erbil.
أجر فرج جانتان ببيري بكرات لا إما باسي روداوي كيف بوي كيف لقال رحمة إمام جلال.
Jonathan.
Randal,
I think Mr. Randal might remember that you mentioned a story with the late Imam Jalal.
إلى صالنا ودكان دا أواني باشماوي أنفال بيني كيان كتاقانا.
He said that in the 1990s, I saw one of the survivors of Anfal campaign.
جيبو مشتكو يعني زور قبره بويا كتشمالاي جناب إمام جلال باسي أوام كسي لمنطقة قرميان كهمو عائلة توشيان فاربونا بتي إمام جلال زور بساطي ورد.
And I was really shocked when I went to Imam Jalal and said that one of the sole survivors of the Anfal genocide campaign lives in Germian, whose entire family been Anfalized or killed during the Anfal campaign. But the late man Jalal said this is simple for us because we all been through that and we are all survivors of such events. And he went on to say that we all need this type of therapy.
من يشعر لو قاتل كلاجل برازيان دانش فعلا لم رؤيا وتتيك إما هموما لم قناغنا درباس بوينا بويا كيسي ما بتشارك سيرين دولنا.
And I agree that back then and now, and I agree that we all need this type of psychological help and therapy.
هر یک کلمانه کلیر دانشجونا چیروکی خوی هیا لامبوارانه.
Each one who are present here might have their own unique stories.
راستا لروی سپوریا و ممکنه بسپوریه کیان هبه.
Some of us might be expert in the area. But there are other members of the family who have been through a lot. So that's why I emphasize that we need this type of support very much, and I know our society might not accept to seek psychological support when they are going through trauma.
باو معرفة وعلمي كليرة وردقرن باو زانيانياني كليرة وردقرن بتشناناو كون أرقام هروها بتوانين خوليتي وتيش بكيني وابو ورزانا لدى.
So therefore this core team of trainees will have the responsibility of taking this knowledge that they get from this training to the society and to help the society to overcome those issues.
ريال وابوسي كسلو خولدا بجدا بين دهيان لوزارتي كارباري كمالاتي بي دهيان لرفراوكاني كمالغاي مدني بي دهيشيان لسنتركاني اواني لمكوانا دايز لكن وانتا لكاتي كايبا بلام اوي من بيبسكوما وكي او سيبياني كوارجيران عندك شرط مروجي نرجي فويها بويا وكي سيبيا كان وارجيران.
Initially, we agreed to accept 30 trainees, 10 from the government institutions, 10 from the civil society organizations, and 10 from the service providers from the private sector. But probably we will have a different division now because there were some requirements during the application process. However, you, at the end of the day, have a great responsibility. I would like to advise you to take these information and this knowledge responsibly and take it out and use it responsibly. As far as the Ministry of Labour and Social Affairs goes, we will support you. And hopefully our partner organizations will continue funding and supporting this project. In the long run, we will also be supporting the continuation of this project. I don't want to take much further of your time. Thank you very much. And wish you all the success and congratulate you as of now.
أفضل زين نقول من فكرت بريت أنا ليش تبي بتكلم بتبعه بيت نتشابش معك بالكلام بداخل بكان صار في شيء نعرف منها كثير ولا هذا يقولوا يجري كما تبدي
Thank you very much, Deputy Minister, for your remarkable speech. And ladies and gentlemen, the UK Consul-General was planned to be with us today. But unfortunately, due to the tragic attacks on Erbil last night, he had other engagements, and on his behalf, I apologize for not participating.
بلان سردا ولا بارس كريس باوتا كمودي كشتر كاتن هلو يبين بريك.
Now I'd like to call upon Mr. Chris Bowers to make his remarks.
Thank you. Well, you don't get a current consul general, but you get a former consul general. So I was a consul general in Kurdistan some 10 years ago, and we've long had a contact with the region. So my task is to sort of tell you how the project came about and why. So it came from a very simple idea, really, which was, how can we make a difference? How can we fill a gap, a very obvious gap in Kurdistan around talking cure therapies? So we gathered together as a little team. There's Dr. Chinar Osman, who is a consultant neurologist in Southampton. Dr. Arva Dosky, who is a doctor of clinical psychology. Are you waving? I can't see, but I hope you're waving. That's the core team. And some Dr. Olivier van den Broek had to leave. He's a busy psychiatrist, but that's essentially our core team. So that's what united us, a desire to make a difference and to see if we could do something to fill the gap, to try to manage that gap in between a medical approach to people who had depression and anxiety and neglect. And so this was the project. This is what we came up with. And when you start out with a project which seemed very ambitious at the beginning, what you look out for are the first people who say yes. And as Paul mentioned, one of the first people who said yes was Dr. Martina Muller. And it's very sad she's not here with us today. But it's fantastic to have Oxford Cognitive Therapy Centre on board. And, you know, we really have gone for the best. And these guys are the best. Another one who immediately said yes was Kak Jihad. And he's been a fantastic partner right the way through. So thank you for your continued support and your continued professionalism and expertise. And the other one who said yes immediately was the KRG, was the Kurdistan Regional Government. There's a recognition that this is needed, and that's right. And so we were delighted right the way through to get a whole series of yeses from the Kurdistan Regional Government. So once we had that determination to do something, I think what we learned as a team was that we had to be open to possibilities. Of course, we had to be determined. That goes without saying, because it's been more than 3 years since we came up with the idea. We had to be curious. And because of a lot of changes, we had to be flexible. And I think those are really good values for you guys going forward as well. If I can give you a little bit of advice, having been through a similar process myself, because I'm also a trained therapist. Those are great values, I think, to take hold of and to really latch onto, because you'll need it through the course, right? You'll need that curiosity about people, the flexibility to learn, the openness to new ideas, and the determination to just get through it and to get things done. But, you know, I think I'm sure it's true for Chinar and Ava and Olivier. When we look out onto this room, I think we're all feeling quite emotional, quite proud. And you are the product. You're what we were dreaming of, that we could find 30 people and do it again and do it again and do it again. 30 people who like us wanted to make a difference and wanted to do that hard work. And it's just absolutely thrilling for us to be, you guys to be there, and for you guys to have the opportunity and the challenge to really make a difference. So thank you.
Para pascarin black kedawa. Esas kantina warna badah wa paresan online atwan
Thank you very much, ladies and gentlemen. I think it's the time for lunch. Unfortunately, you cannot join us virtually to have lunch with us. But thank you very much, and we will get back to you at 1:30.